Thank you. He asked if I to take the sutures out. No, these are 5.0 or 6.0 fast absorbing gut, so they will be gone in 7 days. I do that so I don't have to take them out because I'm lazy like that, and I don't want the team to have to do extra work. So yeah, so they'll be gone in 7 days. There's a question over here.
For sun protection, say you're not doing all the others, you're just doing that. How long do you want like out of the sun?
Great question. She asked about sun protection. If I'm not doing all the others, I'm not worried about it. So if it's just quantum, I haven't violated the skin, I haven't ablated the skin surface, I don't even care about sun, right? Other than the normal caring about sun. Sun avoidance is always good. But as related to the treatment, because I was deep subcutaneous with my quantum, no play at all for any issues with sun. Now with your Morpheus, with your resurfacing, obviously there is things that we need to consider with sun avoidance with freshly ablated skin. Other good questions as the team is doing this Morpheus. And then I want you to see the Solaria. Yes, ma'am.
Can you repeat that? If you don't want to do it with the quantum, you don't want to do the liposuction?
Yes. So she's asking me for clarification on the no lipo option. Like we did not do lipo here. So just know that it is based on surface area, 10 by 15, 10 by 10, 5 by 5. I considered this, 5 by 5 is the palm of your hand. I considered this area 5 by 5. So you reference your 5 by 5 chart, and then you just do a skin pinch test. 3 centimeters, 4 centimeters, and then you just see how many pulses you're allowed. For a 5 by 5 area, with this skin pinch, you'll get 40 pulses. Now, I didn't quite have a 4 centimeter pinch, and I wasn't quite a 5 by 5 centimeter area, so I made 43 pulses, 30. Does that make sense? There's just a clinical judgment call because 43 was on the chart and it just wasn't quite 5 by 5, a small area, and I didn't quite have a full 4 centimeter pinch, so I just called it 30. Make sense? And so as long as I stay within that, I don't have to do lipo because the body's going to clean up all the fat that I've melted. Now, if you have the opportunity to do lipo or you want to do lipo, by all means, then you don't need to pay attention to the pulse count nearly as closely. Her settings for the Morpheus are probably less than 20. Remember, we want a conservative treatment for Dallas. We don't want to beat her up too bad. So it's probably less than 20. At the new software, at 1 millimeter, you can only go 15 kilojoules. So she's probably 15 because the new software only lets you go 15 at 1 millimeter. So that's where she's at. Is that correct, Shannon? Yeah. And then they're firing up the CO2. Other great questions as the team is doing this. So something that I want you to see is look who's not doing this procedure anymore. This guy, right? This amazing team, so well trained, and they just take care of it. Same with the CO2, delegate. And the CO2 creates great ablation in the skin surface. The Morpheus is that next level down, dermal, subdermal elements, quantum subcutaneous tissue. I promise you, promise, you won't achieve results like this will be for this patient with anything else.
One more question. So you said we cannot go over 15 with the 1 millimeters. If I decided, for example, don't have CO2, I decide to do this resurfacing more aggressively instead of doing 1 millimeter Morpheus8.
She's asking about the 15 kilojoule cap. That is a software thing. That's a software. So with the new software, at 1 millimeter, you can't make it any hotter than 15. Resurfacing, I think, help me out, guys. This is where I get lost because my software is not like your software. I don't have the same governors on mine. But help me out. Isn't it capped out at like 20? Yes, 20 is kind of the cap on your resurfacing tip in the software. Like I said, mine is not quite like yours. I don't have the same governors. I can do whatever I want. Okay, Miss Shannon, can we flip over that CO2 and then we'll finish the Morpheus? Just treat the one side that you've treated already with the CO2.